We will now be hearing from Mayor Jim Watson.
Thank you very much, and good afternoon, ladies and gentlemen. Bon après-midi, mesdames et messieurs. My thanks to all of you for joining us today, and I hope you had some time to relax and touch base with your families during the long weekend. Yesterday, as you know, Premier Ford extended the state of emergency in the province of Ontario till May 12th. The City of Ottawa's state of emergency does not have an end date on it, so it remains in place as well. It's important for residents to follow the physical distancing measures that have been put in place. Dr. Etches will be offering some clarifying comments about the guidance that was provided yesterday on physical distancing and the issue of your neighbors and your driveway. I know most of you continue to do just that, and I thank you for your cooperative approach. However, there have been exceptions, and our bylaw and regulatory services continue to receive calls. Tony will be giving you some of that information about people not adhering to the physical distancing rules, particularly in city parks. I want to remind residents that if you're in a park and see someone who's not adhering to the physical distancing measures, please be kind and do not be confrontational. While we're practicing social distancing and safety, we also need to practice kindness because we're all in this, obviously, together. Il faut demeurer patient. Nous sommes tous dans le même bateau. On that note, I want to mention that Crime Prevention Ottawa, in partnership with the Ottawa Coalition to End Violence Against Women, Interval House Ottawa, Ottawa Victim Services, and the Eastern Ontario Resource Centre, has launched an initiative called Unsafe at Home Ottawa. Unsafe at Home Ottawa is a secure and supportive text and online chat for victims and survivors of domestic and gender-based violence. This tool was designed for women who are experiencing physical or sexual violence or emotional or verbal abuse, but are required to stay at home in order to adhere to physical distancing guidelines. The text and online chat options provide women with the opportunity to connect with trained professionals to get advice, coping mechanisms, as well as options for staying safe. The service is available 7 days a week from 8:30 a.m. to midnight by texting 613-704-5535. I'll give that number again, 613-704-5535, or visiting unsafeathomeottawa.ca. As many of you are aware, the COVID-19 virus has been spreading in a number of long-term care homes across the province. Tragically, we're seeing this impact seniors' homes and long-term care facilities particularly hard. In addition, staff who have recently worked at care facilities with COVID-19 positive residents or patients outside of city-operated homes or hospitals will be required to self-isolate for 14 days before returning to work. We're taking these measures in order to protect some of the most vulnerable members of our community. Nous prenons ces mesures afin de protéger les résidents les plus vulnérables. To date, there have been no confirmed cases of COVID-19 in the city's 4 long-term care homes that we operate ourselves. We're remaining highly vigilant as we know that there is a real possibility that a case could present itself at one of our 4 city-run homes. This is why we're doing everything we can to help protect our residents who have entrusted us with their care. Some of the proactive measures we're taking include increasing cleaning in facilities, a daily screening for staff both at the start and end of the shift, including a temperature check. All residents are screened twice daily for symptoms, and any resident showing symptoms will be isolated and tested for the virus. Working to ensure there is enough personal protective equipment or PPE for our staff, and newly admitted or readmitted residents are automatically isolated for 14 days and tested for the virus. If a case is confirmed in one of our long-term care facilities, the homes have the pandemic plan to follow, along with directives from the province and guidance from Ottawa Public Health. Je souhaite répéter que notre priorité est d'assurer le bien-être de chaque résident, en particulier ceux qui travaillent et vivent dans les maisons de soins de longue durée. I've asked Councillor Jenna Sudds to join us on Monday's media availability to provide a more substantial update on the work of our Human Needs Task Force. And there's some very good work that's being done for the most vulnerable members of our society. I want to shift focus for just a moment in my final remarks to talk about the potential of flooding in Ottawa this spring. As a city, we're planning for potential flooding as we have in the last several years. And while many people are handling the COVID-19 emergency, a separate team from the city has been set up to plan for and respond to potential flooding. The City of Ottawa is working with external partners to monitor water levels and ensure a coordinated approach to any flooding that may occur this spring. I have some good news that the risk of flooding along the Rideau River seems to be behind us. Although along the Ottawa River, the city continues to prepare for the potential of flooding in low-lying areas. But thanks to last year's volunteer efforts, we have thousands of unused sandbags filled and ready to go. These sandbags have been packed into yard bags and are being delivered to low-lying communities that typically see spring flooding this time of year. The city also has 21,000 tons of reclaimed sand from last year and 387,000 unfilled bags ready to go if needed. Sandbag material is also available at several public works yards for residents who may need it. We ask that you please bring your own shovels and work gloves if accessing any of these locations to fill sandbags. Et s'il vous plaît, assurez-vous de garder votre distance. While it's understandable and expected that residents will make every reasonable effort to protect property due to COVID-19, we must all remember to practice physical distancing as outlined by Ottawa Public Health. Any work being done should be limited to 5 people or less, as mandated by the province of Ontario. I want to thank, West Carleton March Councillor Eli El Shantiri, our designated councillor liaison, for supporting all of the councillors in their affected areas to get information back and forth and ensure that we have the most up-to-date flood numbers so we can act appropriately. Again, we'll continue to monitor the water levels along the Ottawa River, and we are receiving regular updates from the Ottawa River Regulation Planning Board, who are providing us with a 3-day forecast. We must remain cognizant that situations could change quickly if we receive a large amount of precipitation or if warmer temperatures up north produce a quicker melt. We have reactivated our Facebook flooding group, and you can also get up-to-date information on ottawa.ca. Thank you. Merci beaucoup.
Thank you, Mr. Mayor. We will now hear from Chair Eglai.
Thank you very much. Hello, bonjour, Kwe. I want to thank everyone for continuing to flatten the curve with physical distancing over the long weekend. I know that this might have been a bit more difficult holiday for many, and I want to give credit to everyone who did their part to help flatten the curve. The collaboration and cooperation of our residents is very much appreciated. I believe that we are a caring and compassionate community that is coming together to make the best out of a very tough situation. Unfortunately, physical distancing is a difficult endeavor and has potential negative outcomes. The one that I would like to highlight today is the increased risk and incidence of elder, spousal, LGBTQ2, and child abuse. Previously, interactions with observant and caring members of our community would help identify if and when such abuse was occurring. Unfortunately, with physical distancing and the potential isolation it presents, it is difficult for abuse to be recognized and addressed in our community. Therefore, I encourage our community to virtually reach out to each other and work together to ensure that vulnerable members of our community aren't being abused. I want to encourage people to utilize the incredible resources available: the Children's Hospital of Eastern Ontario, the Children's Aid Society, the Distress Centre of Ottawa, that's 613-238-3311, Kids Help Phone, 1-800-668-6868, or text 686868. The Champlain Community Support Network's resources for older adults, and the Ottawa Police Service. All offer excellent resources to help prevent and assist in abuse situations. There is also, as the Mayor pointed out, a new program launched with the support of Crime Prevention Ottawa, a resource for people who feel trapped at home with someone who is abusive. By working together and using the resources that are available, we can help protect our society's most vulnerable. For more information, please go to Ottawa Public Health's website. There's a full list of resources available in their mental health section. Lastly, I'd like to share some good news with everyone. The health system's regional capacity to test more people has increased considerably. This means that we now test a larger segment of our community. That being said, we can only test the individuals who present themselves for testing. I want to encourage people that have fever, cough, or difficulty breathing to go for testing. There are many other situations in which we recommend testing. Please go to our website for the latest information. Thank you. Merci.
Thank you, Chair. We will now hear from Dr. Etches.
Thanks. And I want to start today by recognizing that it's actually been exactly 1 month since I first asked people to limit their contact with others to be able to reduce that spread of COVID-19. And this has required a major change in all of our lives. We've had to adapt our ways of getting support, and we've even had to change how we interact with our friends and our family, who are often the people we turn to for support. So I really want to thank the residents of Ottawa, people in Ottawa who have been doing this hard work. And I want to give you credit that you are the reason why we are being able to manage our healthcare system right now. The number of cases of COVID-19 in our community are manageable. Our emergency departments are functioning. If you have an emergency health issue for any reason, please go. And the reason they're doing this is because we've been able to limit the number of infections in our community through physical distancing. It's not easy, and we're not over the peak of the curve and onto the other side of the curve yet. Therefore, I will keep communicating about what people need to be doing, what it means, what we're asking of the public when it comes to physical distancing. There is still a provincial order in place that limits gatherings to 5 or less. So that is in place. And the advice to stay home remains that you should stay home except for going out for essential reasons. And those things like getting groceries, getting prescription drugs, helping somebody who needs support, or getting out for physical activity. And we keep getting questions, about what does physical distancing mean? So one that came up yesterday, can you talk with your neighbor over the fence or from a distance? And yes, you can. As long as you're maintaining the 2-meter distance from your neighbor, you're doing your part to reduce the transmission of COVID-19. We're asking people to have those interactions at a distance and to take care to avoid creating a gathering or leading to actions that could increase risk of transmission. So people are worried when they see others gathering in parking lots and driveways, because we know this is a challenging disease. COVID-19 has caused asymptomatic infections and causes infection where people don't realize that they could pass on that infection yet until they get more obvious symptoms. And so that's why we need to continue to treat each interaction with another person as a potential risk for transmission, which is challenging. And of course, we want to connect with other people during difficult times. So you do want to be able to talk to your friends, lean on your families, and connect with your neighbors. What we're asking is that you use your best judgment to consider the safest options for doing so, and take advantage of technology, connect with friends and family, try as much as possible to limit your in-person relations. Bien sûr, les gens veulent se connecter avec les autres dans les moments difficiles. Vous voulez pouvoir parler à votre meilleur ami, vous appuyer sur votre famille et vous connecter avec vos voisins. Nous vous demandons d'utiliser votre meilleur jugement et d'envisager les options les plus sécures pour le faire. Profitez de la technologie pour vous connecter avec vos amis et votre famille et essayez autant que possible de limiter vos contacts en personne aux membres de votre foyer. So people keep asking about whether they should go outside for exercise, and physical activity and getting fresh air are important for our overall mental health and well-being. Unless you've been asked to self-isolate under the Quarantine Act, or if you're sick, you can still go for a walk, run, or ride your bike in your neighborhood on shared paths or through your local park. And Ottawa Public Health has added new resources to our website on staying active during this time and maintaining your mental health. For those that are experiencing financial crisis, please also check the City of Ottawa website, where there's a list of resources available from all levels of government. And I would also like to address, as the Mayor did, the approach to protecting people in long-term care homes and retirement homes. Ottawa Public Health shares the concerns expressed by the community, by family members, by other levels of government about the importance of protecting this vulnerable population. Santé publique Ottawa partage les préoccupations exprimées par la communauté et par les autres niveaux du gouvernement quant à l'importance de protéger la population vulnérable dans nos maisons de retraite et foyers pour personnes âgées. All long-term care homes and seniors residences operating in the City of Ottawa receive regular communications and guidance from Ottawa Public Health's Infection Prevention and Control team. They're familiar with outbreak management protocols and the testing guidelines for COVID-19. And for some time now, Ottawa Public Health has been instructing all retirement homes and long-term care homes with even one positive case in a healthcare worker or any resident to take all the measures required that would protect someone from a respiratory outbreak. New testing guidelines issued last week mean that we are now expanding COVID-19 testing in these homes that are in outbreak to include asymptomatic residents and healthcare workers, whereas previous direction was only to test when somebody had symptoms of illness. Also, for all homes, the threshold for testing has been lowered, so all residents now will be tested even if they don't have a fever and a cough, if it appears that their health status has changed and it could be due to COVID-19. Also, everyone being admitted to a home will be tested, even if they do not have symptoms. Other supports are being added to long-term care homes and retire homes through an increased partnership with the healthcare system in Ottawa and across the region. So there's faster access to personal protective equipment, masks and gowns, and there's faster access to supports if people need the staff to be able to do the testing and some of these other pieces. So I'll turn just lastly to the numbers. Maybe the media can let me know if they want to hear from me about the numbers every day, or you're happy checking our website. But as of 4 p.m. yesterday, Ottawa Public Health is investigating 643 lab-confirmed cases of COVID-19 in the community, and there are 16 outbreaks in institutions. That's 24 new cases from yesterday, and we also have 244 resolved cases. There are currently 41 people in hospital, and 18 of them are in the intensive care unit. Sadly, 13 people have died. 5 of those are related to an outbreak in a long-term care home or a retirement home. And of all the 13, 11 were over the age of 65, and 2 were between ages 45 and 64 years. 6 men and 6 women. Depuis 16 heures hier, Santé publique Ottawa enquête sur 643 cas confirmés en laboratoire dans notre communauté et 16 éclosions continuent dans des institutions. Cela représente 24 nouveaux cas depuis hier et nous avons maintenant 244 cas résolus. Il y a présentement 41 personnes à l'hôpital et 18 d'entre eux sont en soins intensifs. Malheureusement, 13 personnes sont décédées et le nombre dans les institutions avec une éclosion, c'est 5. Parmi eux, 11 avaient plus de 65 ans et 2 étaient âgés de 45 à 64 ans. 7 hommes et 6 femmes. So thank you again to everyone in the community. By staying home, you're keeping yourself safe, you're protecting your loved ones, you're protecting others. You're making the community safer for those who need to go out to perform the healthcare work and essential services and help those folks do what they're doing to save lives. Thank you very much. Merci beaucoup.
Thank you, Dr. Etches. We will now be hearing from Mr. Anthony DiMonte.
Thank you. Merci. The City of Ottawa closed all parks when the province of Ontario enacted physical distancing rules under the Ontario Emergency Management and Civil Protection Act. Yesterday, the state of emergency in Ontario was extended for 28 days to help keep the public safe and reduce the spread of COVID-19. Gatherings over 5 people are not allowed under provincial law, and we continue to advise everyone to stay home as much as possible and to limit travel. Les rassemblements de plus de 5 personnes sont interdits en vertu de la loi provinciale et nous continuons de conseiller tous les résidents de rester à la maison dans la mesure du possible et de limiter leurs déplacements. L'état d'urgence déclaré prolongé est également la fermeture obligatoire des entreprises non essentielles et des parcs. The emergency declaration also extends to the mandatory closure of non-essential businesses and parks. This includes all amenities and equipment such as swings, courts, skateboard parks, benches, picnic tables, ball diamonds, and sports fields. People are allowed to travel through the parks, but lingering, gathering, or prolonged stays are prohibited. The city and the province have been in lockstep in taking significant actions to help flatten the curve. Les résidents ont l'autorisation de traverser les parcs, mais il est interdit de s'y rassembler, de s'attarder ou de rester pour une période prolongée. La ville et la province travaillent conjointement en prenant des mesures importantes dans le but d'aplanir la courbe. We must follow the instructions of Ottawa Public Health and federal and provincial authorities to keep everyone safe. While most people understand the reason for these closures and are abiding by these restrictions, some have asked why simply a visit in the park is prohibited. Parks attract people, which can lead to gatherings that go against our important physical distancing measures. While it may seem harmless for one parent to throw a ball with their child in a park, we need to look beyond those two family members. That's why there are no exceptions to the rule, no matter how simple or harmless an activity may appear. It is also important to keep in mind that the park and equipment and amenities are not cleaned and sanitized, and COVID-19 virus can be present on any surface. In fact, some conditions, the virus may live on surfaces for a significant amount of time. Our bylaw officer's priority is to inform and to educate. However, we are proceeding with fines as provided for by the province under the Ontario Emergency Management and Civil Protection Act when warranted. We are doing so to protect the public, and we need people to understand that their actions can endanger others. These restrictions and closures have a real purpose: to prevent further spread of the virus and, more importantly, to save lives. Nous prenons ces mesures pour protéger le public et nous voulons que les résidents comprennent que leurs gestes peuvent avoir des conséquences dangereuses pour le reste de la population. Ces restrictions et fermetures ont un objectif réel: de prévenir davantage la propagation du virus et surtout de sauver des vies. The number of fines handed out to residents are small compared to the number of requests we've received. From April 2nd to April 14th, we responded to over 2,205 service requests related to COVID-19, and yet our bylaw officers only issued 76 provincial offenses. In most cases, the first step is warning. Officers inform residents of the law and provide this verbal warning. But in some cases, tickets are issued. Over the past weekend, for example, a company was going door to door to solicit landscaping services. Bylaw officers also had to charge an owner of a local barber shop this weekend who was continuing to offer services after being issued a verbal warning the previous evening. In addition, on Monday, one of our bylaw officers had to turn away 20 vehicles from parking at Dick Bell Park, even though the park, as well as the parking lot, was closed. We understand how this pandemic has turned our lives upside down and disrupted the simple things in life, but we need to stick together with this battle to flatten the curve. Nous comprenons que cette pandémie a chamboulé nos vies et a perturbé les moindres petites choses qu'on tenait pour acquis. Mais nous devons agir ensemble si nous voulons combattre cette bataille afin d'aplanir la courbe. As a city, we need to do everything possible to slow the spread and protect our most vulnerable citizens, our healthcare workers, our first responders, and the many other providers of essential services on the front line. The sooner we can stop the spread, the sooner we can enjoy our parks and be in company of our friends and family once again. En tant que ville, nous devons faire tout pour prévenir et ralentir la propagation du virus et protéger les résidents les plus vulnérables. Plus vite que nous mettons fin à la propagation, plus vite que nous joindrons les parcs et retrouverons la compagnie de nos amis et de nos proches. Ensemble, ce que nous ferons seront plus forts. We're all in this together. Merci beaucoup. Thank you.
Thank you very much, Mr. DiMonte. We're now going to move into questions. I will quickly do a roll call to see which agencies are online. If I've missed anyone, please let me know. Je vais confirmer les noms des médias qui sont en attente. Si je vous ai oublié, s'il vous plaît, me laissez savoir. 104.7 Outaouais, Olivier Charbonneau. 1310 News, Jason White.
Here.
And do we have 104.7 Ottawa? Olivier, es-tu là? Okay. We're moving on to Barrhaven Independent. Do we have Barrhaven Independent? Okay, we'll move on to Manotick Messenger. Do we have Manotick Messenger? Do we have Richmond Hub? Okay. CBC?
Here.
Thank you, Kate and Joanne. Do we have CTV? Josh Pringle, CTV?
I'm here.
Thank you. Do we have Brian Mullen, Global? Or Craig Lord, Global?
Yep, Craig here for Global.
Thank you. Est-ce qu'on a Julien Paquette, Le Droit?
Oui.
Merci. Who do we have from the Ottawa Citizen?
Joanne Loss, yes.
Thank you. And from Ottawa Community Voice? Pat.
Yeah, I'm here.
Thank you. Est-ce qu'on a Pascal Marie Dufour de Radio-Canada?
Oui, je suis là.
Merci. Jadrino Huot, TVA Gatineau. OK, merci de Jadrino. Jake Davies, West Carleton Online.
Present.
Thank you. Have I missed anybody? Est-ce que j'ai manqué quelqu'un?
Yeah, just Taylor Blewett at the Ottawa Sun.
Perfect, thank you. Again, a reminder to remain on mute until I ask you to ask your question. I'll now invite each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions des médias qui pourront poser une question et une de suivi. So we'll begin. On va commencer avec Olivier Charbonneau à 104.7 s'il est là. OK, sinon, on va aller à 1310 News, Jason White.
Yes, my question is for sort of jumping off something, Councillor Eglai, something that you said, and if Dr. Etches wants to weigh in as well, that would be great. A question about the testing and encouraging people who have things like fever, cough, difficulty breathing to go get tested for COVID-19. Can you explain a little bit more about the thinking behind that, and how much does that deviate from what we were told near the beginning? Because it seemed it was a very narrow set of people who were being told you should go get tested, other people not. Can you explain a little bit more about why you're encouraging people now to go get tested for COVID-19?
I'll start off, and then I'll let Dr. Etches jump in. Simple answer. Part of the simple answer is that we have more capacity now. Tests can be turned around more quickly, and we want to reach a broader base of people. The challenge we're having is making that known so that we can get the people we want to get in to get tested. So hopefully through today's media event, that message will get out to a broader base. And I'll just turn it over to Dr. Etches to explain a little bit more of the medicine behind the change.
Yes, I think I appreciate what the chair is doing to try to help people understand that they may have thought previously they didn't belong in a category that's a priority for testing, but those categories have been increased. So to be really clear, I can't yet advise that we have enough laboratory testing capacity to process anybody who has a fever and a cough, but we do have room to go further than we have previously. And so what we are asking is for that population who maybe before you thought it was only healthcare workers that could be tested, that could show up at the Brewer Assessment Center for testing for COVID-19. What we're saying is you might be like a healthcare worker. You might be someone who's providing care for someone, and that qualifies you for testing if you get symptoms. So if you have a fever and a cough yourself, you have some respiratory symptoms, if you get tested and we can make sure that's not COVID-19, that helps protect the people that you're caring for. Also, we know that household members of healthcare workers are an important group that we're inviting. If you have a healthcare worker in your home, it really matters if you have COVID-19, that affects their ability to work. And so we want you also to come, present yourself for testing if you have symptoms of illness. And so the list that we've expanded to is on our website. It also includes, of course, we're doing more and more testing as we can in the long-term care homes and retirement homes, people who are hospitalized. We're also saying people who live in a rural or isolated area where you might have more difficulty accessing supports for healthcare or others, Indigenous communities, First Nations, Inuit, Métis, please, these are also populations that we want to decrease the barriers and make sure if you're sick with respiratory illness, you can be tested. First responders, emergency workers, police, fire, paramedics. These are also populations. And then there are also specific groups where it matters if you have an immunocompromised system. So if you're more vulnerable due to cancer or something like that, it's useful to know if the illness you have is COVID-19 so that we can intervene earlier. And the same is for pregnant women in their last trimester. We know that infants are more at risk for negative outcomes. And so being able to rule out COVID-19 in the last part of a pregnancy is also useful. So again, just as the chair did, want the public to know that we've broadened the groups of people for testing. And if you fall into those categories as listed on our website, please use the service that's there.
Thank you. One quick follow-up, Dr. Etches, what would you advise people in a nutshell to do if they have a cough or a fever, for example? Should I go to one of these care clinics in the West and East Ends and then let the doctor decide whether I should get tested? Or what would you recommend someone who has a cough and fever do at this point?
Okay, so I just spoke about if you fall into a priority group and you're sick, you should present for testing. If you don't fall into one of those priority groups and you have a fever and a cough, first thing, stay home so you don't get other people ill. Make sure that you are doing your part to keep yourself isolated and have others go out and do those things like groceries. Secondly, if your symptoms are not getting better, then you should present to one of the care clinics. There's one in the East, there's one in the West, and those care clinics will be a place where you can get that full assessment. If you need a chest x-ray, you can get a chest x-ray. If somebody thinks you need to go to emergency, they'll be able to facilitate that.
Thank you.
Thank you.
We'll now move on to CBC.
Sorry about that. I was wondering if you could explain, it's probably to Dr. Etches, the mixed messaging, because we did get a lot of feedback after the comments made yesterday about no having a drink in your driveway with your neighbor.
Sure. I wasn't here yesterday, so I didn't hear exactly how everyone made comments or asked questions. I think what came through was a common concern. We all want people to do their part to maintain two meters distance from one another. And so I think, the question was raised about whether this meant, visiting neighbors over a fence, was that a risk? And we know that in itself is not a risk. People can definitely say hi, check in with your neighbor. That's important as long as you're keeping that 2 meter distance apart. I think where the concern rises is we know that sometimes if people stop where there's not a fence and they're talking and then others come and stop, and it can turn into a gathering. So those things are a concern that we get phone calls and people are concerned about those kinds of things because they could lead to risks. So really, this is something we know the public's really, for the most part, been doing an excellent job and maintaining, the physical distancing throughout a month now, which I just need to thank everybody for doing that and recognize we're all doing our best and it's working, right? So I want to thank everybody for doing that. I think so the messaging hasn't changed in terms of what we want people to do is maintain those 2 meters and be careful of gatherings. That remains.
The other question had to do with the peak. You said that we were not on the other side of it. Are we closer to it? Are we starting to be in it now, perhaps?
There are some suggestions when you look at the information that things are going along well in terms of the projections and the models that show us being able to manage that keeping the infections at a lower level. So what we're looking at, for instance, is the ICU admissions, the hospitalizations and the ICU admissions, and they seem relatively stable. So that is good. I mean, here in Ottawa, we're seeing a slight increase, maybe 1 or 2 more beds each day in the intensive care units being used. So I can't say we're at the peak because we're still going up, but it's not a rapid increase. And I am watching that very carefully to hopefully we will start to see that decrease.
Okay, perfect. Thank you.
Thank you, Kate. We will now go to Josh Pringle at CTV.
Thank you very much. Dr. Etches, the NCC announced yesterday plans to close part of Queen Elizabeth Drive. Are you okay with closing roads, or does that sort of fall into what you said a few weeks ago at Council, where you don't want to create places where people gather?
Our top advice is for everyone, right, to maintain your distance from others. And so that is what we want. We're going to be monitoring the situation with the NCC as they try something out. If people are not keeping their distance from one another, then that's not a workable, option. And the gatherings too, right? It's illegal actually to gather in more than 5, in one place. So I think these are things we have to assess and weigh, and the Ottawa Public Health team will be providing advice about, in how to do things safely. The logistics of that are really up to the NCC. They're going to be looking into how they can do this and evaluating.
And just a follow-up question. It's been a month since you asked people to first start practicing social distancing, physical distancing. What do you say to people who are starting to get tired? They have kids at home who are getting a little restless, don't understand. Like, first off, do we know how much longer we may have to do this? And what are we going to do to sort of make sure that people stick with this?
Yeah, so we're not over the peak yet, but there are hopeful signs that we are doing things that are effective. And the more we can maintain that for a couple of weeks, hopefully we'll be able to see a decrease in some of the hospitalizations. And so, there's a bit of hope that we're going to be able to start to talk about how do we relax some of these restrictions. And so I can't say that yet, but I guess the hope is, maybe to convey to people, we are thinking about the end. Like, we are talking now about how do we best support people to get, the things they need to get a little bit more freedom. So this is something, I guess, just to let people know that we're all feeling it. We know it's very important to relax the restrictions as soon as we can, and we'll be working towards that. And it's a conversation it's good to have as a community. I'm actually interested in thinking about ways we can get people's input. So what are the most important things to relax first in the opinion of the public? This is an important conversation we can have. There are a number of things that need to be in place, right? We need to know that our hospitals can cope with a rise in infection, that they have surge capacity. We need to know that we have enough testing capacity to test for everybody who could have an infection and then follow up with them. So we still have some room that we need to have this physical distancing in place to allow that preparation and that security to be able to safely, talk about how we relax restrictions.
Thank you.
Thank you. We will now move to Craig Lord at Global.
Thanks. This would be for Anthony, I believe. Is the city upping its enforcement right now of the emergency order to include activities such as gathering in the driveways and on people's properties, like Dr. Etches was talking about? And if so, why now?
Actually, no, we haven't intervened in any of those cases. As Dr. Etches indicated, if people maintain the safe distance, there's no reason to. Of the 76 charges that we've had over the last few weeks, only 3 have been in private homes, and they were all as a result of parties and large gatherings. No, it's not our intent to intervene of people talking between driveways or over fences. And we encourage them to follow Dr. Etches' advice to keep a safe distance. So it's not part of our process right now, and we have no intent to go there.
Okay. If, say, a neighbor sees people gather, the beginnings of a gathering in a driveway, what is the advice to them? Do they call bylaw in that situation, or what is the process there?
Well, I would hope that people are heeding Dr. Etch's advice, and I think that's where it starts, from a fundamental responsibility that we all have to work on this as a community. Maybe you can, if you've got a good relationship with your neighbors and don't get aggressive, you can say, hey guys, keep some distance. But yes, if people feel that that's not an option for them, they can call 311. And if the gathering is not one that would be defined as legal, and there's a large amount of people, we'll try to intervene. We'll intervene and correct that behavior through through encouraging people to move on.
Thank you.
Thank you. On va passer maintenant à Julien Paquette à le droit.
Oui, bon, je ne sais pas qui est le mieux placé pour répondre à cette question-là, mais M. Dimonté a soulevé l'exemple de, par exemple, un parent qui lance une balle avec son enfant dans un parc. On comprend évidemment l'importance d'éviter ça. Est-ce que c'est possible de donner des pistes d'explication qui pourraient nous permettre de mieux dire aux gens pourquoi c'est important d'éviter ça, ce type d'activité-là? Je sais aussi que la semaine dernière, pendant le forum public, on a parlé, il y a eu une question sur le tennis, par exemple. Donc, peut-être nous donner un peu plus de...
Bien, à prime abord, l'ensemble de ces activités-là, par la direction provinciale, sont techniquement illégales. Le gouvernement de l'Ontario a indiqué que tous les parcs et les activités et l'ensemble des appareils dans des parcs sont actuellement, on ne peut pas les utiliser d'une part. En fait, essentiellement, ce qui arrive, c'est que si une famille commence à jouer avec une balle et on se retrouve avec une autre famille, soudainement, on crée un environnement qu'on encourage et on se retrouve avec un rassemblement assez important qui va à l'encontre de l'ensemble de ce que Santé publique nous dit, Santé publique Ottawa et au niveau provincial, on nous indique. Donc, on veut éviter ce phénomène-là d'évolution, mais à prime abord, c'est une activité que actuellement, selon l'ordonnance provinciale, est des parcs qui sont fermés. Nous, on donne une exception. Les gens peuvent se promener à travers les parcs. C'est important pour la santé physique, la santé mentale, comme le Dr. Etches nous indique, mais on veut que les gens respectent cette consigne-là provinciale et le règlement qui est mis en place pour qu'on soit en mesure de passer à travers ce processus-là le plus rapidement possible.
Parfait. Et puis, pour ma sous-question, si c'était possible, Dr. Etches, de nous répéter ce qui a été dit en anglais par rapport à l'élargissement des critères pour subir un test. Je comprends que les gens ont pas tout à fait compris encore qu'ils sont peut-être maintenant éligibles à subir un test.
Oui, d'accord. Maintenant, nous avons des laboratoires à Ottawa qui ont la capacité de faire plus de dépistage. Alors, le nombre de groupes de priorité qui sont ouverts pour accéder le dépistage sont plus nombreux. Alors, ce n'est pas juste les travailleurs essentiels ou les travailleurs de la santé. Maintenant, c'est aussi les personnes qui donnent les soins aux autres, qui sont comme un travailleur de la santé qui peut aller avoir un dépistage pour COVID-19 si ils ont des symptômes d'une maladie respiratoire. Aussi, c'est important pour les gens qui aussi habitent avec quelqu'un qui est un travailleur de la santé parce que c'est important de protéger le travailleur et de déterminer si c'est COVID-19 ou non. Alors, il y a une plus grande liste de personnes sur notre site web santépubliqueottawa.ca. Et je voudrais encourager les gens dans les groupes de priorité d'aller à le centre de dépistage si vous avez des symptômes.
Merci beaucoup. We'll now move on to the Ottawa Citizen. Nope. Sorry, you're muted there, Joanne. Would you mind unmuting?
There, can you hear me now?
Yes.
Yesterday, Dr. Mlockney was talking about people who were looking for loopholes. I'm wondering if all three of you could address the question of what might fall into that loophole category that you do not want to see.
Maybe I'll start with that. I think, as Dr. Etches said earlier, we've had amazing cooperation and collaboration from the community. I think we did a survey and compliance with social distancing is coming in at 84%. Tony spoke to the number of charges that have been laid. I don't think he gave us the number of investigations or complaints, but it's a fraction of the complaints that are coming in. So I think the residents of Ottawa are doing a fabulous job, and we need to thank them for that. Is there 100% compliance? No, but it's going very, very well. And I think to one of the questions was asked earlier, what would you say to people that are finding it tough and difficult? And I think what we would say is it's working, it's helping, and it's making a big difference. So it's not so much about people looking for loopholes or not looking for loopholes. We encourage people to continue to follow the direction that's been set out by Ottawa Public Health for the plain and simple reason that it's working. And I'll let the other two weigh in.
Yeah, that's what I wanted to also focus on. What people are doing, is trying to do the right thing, and so I'm not sure if there's a loophole. I don't. That's not really language that I'm dwelling on or thinking about examples of. What I'm thinking about is where is there a lack of understanding? Where is there a lack of clarity for people? And the places where I find that people just maybe aren't clear enough relate to, the parks and can I go through the park? Can I stop in the park? So we've been continuing to try to increase messaging and communicate in more than English and French also, trying to work through community groups that are connected to populations that are going to be speaking other first languages besides English and French to make sure things are understood, right? That's the first place, because we are finding that when people are clear about what the guidance is, then they're following it. And the other thing then that I'm focused on is what are the barriers to maintaining physical distancing. So there are times when we see people just don't have the support they need to be able to do it. And so, if there are things we can add in as a city from a human needs point of view, can we help people get their groceries? Can we help people have those basic needs met? And that allows them to do physical distancing, then that's what we're trying to do. So, that's what I'm focused on. And again, I do need to thank people because this is hard. It's hard to maintain. And I would encourage people when it's getting tough to reach out to others.
I'd just add to the chair and Dr. Etch's, chair mentioned it's less than 3% where we have to do an intervention from a an enforcement perspective, and enforcement's never a solution. And good points were raised, but more broadly, I mean, when one talks about loopholes, it's like we're looking to try to game the system. This is about us as a community and each individual assuming responsibility, listen to the professional advice we're getting from Dr. Etches and the results we're getting. And it's not a question of loopholes, it's especially about being responsibility and helping your neighbor and helping a loved one and ensuring we minimize the people that are impacted and even more critically, those who lose their lives as a result of this pandemic. So I think we're doing a tremendous job as a community, and we've got to keep doing that. And it's an individual responsibility. It's not a question of finding loopholes.
If I could just offer a comment as well. I've received a lot of feedback on this issue, and to be very clear and precise, if you and your neighbor are having a conversation and it's with or without a beer at the end of your driveway, as long as you're 6 feet apart, then you're not going to be bothered. If that turns into a gathering of more than 5 people and it turns into a big barbecue or something, then obviously that's a problem. But I think there was perhaps some misinterpretation yesterday. I wasn't on the call either, but to be very, very clear, if you and your neighbor are having a beer or a lemonade and you're at the end of your driveway and you're 6 feet apart, 2 meters apart, then enjoy.
Follow-up question. Can you tell me a little bit about, we're into the 1 month period and it looks like it'll take several weeks, if not a month to maintain this message. And people, I think, are finding themselves a bit fatigued. What can you do to keep this message on the front burner and make sure that there is something about it that remains new and interesting to them?
It's a question maybe for me. You know what? This is where we need to listen to the community and what are their ideas. So there is a huge amount of creativity out there. We've seen a lot of support, neighbor to neighbor, in neighborhoods, people finding ways to connect at a distance, sending messages through their windows. Is there something now we could challenge ourselves? Ottawa, what do you think? Like, what's the next thing we need to do to keep it together, to manage to stay 2 meters apart for a little bit longer? I'm interested in what the community could come up with as a challenge to help us do that. As I say, I need to keep communicating the rationale, like why. Why are we doing this? And I will, keep sharing the information that our hospital system isn't ready yet. They're working hard. They're trying to create more beds, more ICU beds. They're trying to make sure they have the gowns and the gloves and the masks and everything that's needed so that we can relax restrictions. And then, unfortunately, we'll probably see infections rise, but we'd be able to handle it because our system's prepared. So I think talking about the rationale, helping people understand why we're getting there, we're going, along well, and we need to keep it up.
Thank you. We'll now move on to Pat Igocioni from Ottawa Community Voice.
My question was for Dr. Etches, and it's going back to the NCC possibly opening up the Queen Elizabeth driveway and the city opening up the Bank Street Bridge. Were you or OPH in on that conversation?
We're not really involved in the conversations because most of this is a logistical question of what can be done operationally, what is able to be done given that the streets need to be used for different things. Where we get involved as Ottawa Public Health is making recommendations around what needs to be in place, which is to try to keep people 2 meters apart and avoid gatherings greater than 5. So that's where we get involved in terms of providing advice. If it looks like it's an impossible situation, we'll say that. But mostly this is not something that we're not involved in the details of decisions.
And my follow-up would be for Mayor Watson. I think you've been pretty vocal about this, especially on social media, that you weren't in favor of opening up a lane, say on Bank Street, for a stretch of Bank Street. Yeah. I haven't heard you weigh in on this, so I'm asking do you still have the same concerns about opening the QED or the bridge on Bank Street?
Yeah, there are two issues. One, Bank Street, as you know, I was not in favor of closing down a whole section of Bank Street, and I'm pleased that our staff pushed back against that suggestion. I've said all along that if there was one compromise, it would be the Bank Street Bridge, because it is particularly narrow. We've got to make sure that we have the proper safety mechanism in place, because as you know, sometimes it's hard to see as you're going over the top of the Bank Street Bridge between Wilton and Aylmer Avenue. So from the perspective of city staff, they've given that the okay. They have not supported closing other sections of Bank Street. In fact, the Glebe BIA, I think, just sent a letter in today saying that they would have concerns if that was going to take place as well along a long stretch of Bank Street.
Thank you. Merci. I will now move on to Pascal-Marie Dufour, Radio-Canada. Pascal, il faudrait mettre ton microphone sur unmute.
Ça va?
Pascal?
Vous m'entendez?
Pascal, oui, on vous entend maintenant.
D'accord, là, ça va, je n'ai pas de questions. Merci.
OK, parfait. Jadrino Huot de TVA, avez-vous des questions? Okay, so the question is on the chat, so I will read it out loud in French and in English. Dr. Etches, après un mois, comment qualifieriez-vous les statistiques actuelles pour Ottawa en fonction de vos prévisions à l'origine dans la cible plus élevée ou moins élevée? Would you like me to read it in English, Dr. Etches? Oh, sorry, you're on mute.
OK. Vous voulez savoir si nous sommes une cible élevée ou plus bas concernant le nombre des infections dans notre communauté?
So Jadrino would like to know if the numbers at the moment, if they are aligned with the predictions that you had, or if they're not, are they more elevated or less elevated?
OK. Un mois auparavant, nous n'avons pas un modèle de prévoir exactement le nombre de cas aujourd'hui, mais concernant la situation, c'était possible d'avoir un plus grand nombre de cas, bien sûr, si nous n'avons pas accepté et faire la distanciation physique. Et je pense que c'était la dernière réunion avec le conseil de la ville où j'ai partagé les modèles pour Ottawa. Et maintenant, on suit la ligne le plus bas. Alors, ça, c'est bon. Nous avons, après quelques semaines, la ligne plus acceptable concernant le nombre des infections dans la communauté. Alors, c'est bonne nouvelle. Et on continue de savoir que le nombre de cas dans notre communauté, c'est pas un nombre que j'ai, c'est juste le nombre de cas confirmés. Mais on utilise cette norme et les normes des hospitalisations d'avoir une idée comment on va. Et ça, c'est encourageant.
Thank you, Dr. Etches. Est-ce que vous avez une autre question? OK, merci. We will now move on to Jake Davies at West Carleton Online.
Hi, thank you. A few weeks ago, Councillor Eli El-Shantiri was curious if there was going to be any efforts to reach through perhaps a mobile testing unit in terms of COVID-19. I was just wondering if there was any further action on that, or what attempts there have been made to assist people in rural Ottawa.
Yes, so the Ottawa Hospital, excuse me, the Ottawa Hospital is leading a response that includes considering how to get services out to all areas of the Champlain district, including rural. And so our health system partners are working on increasing the ability to go out to vulnerable populations who need testing even in their homes. This is something that, there are a number of different strategies being investigated, whether it's paramedics or family doctors. And so I think the best update would come from our healthcare partners who are planning to talk about this system of testing people, vulnerable populations, wherever they are, very soon.
Thank you. And my follow-up is, I spoke to a private PSW person earlier this week, and while a lot has been done to protect the long-term care homes in the Ottawa area, his concern is that often several different agency support members come into the homes of his clients in the course of the day and in the course of the week. Is this something that concerns you and something you've considered?
Yes. Personal support workers specifically have been top of mind for a number of weeks, as we saw, that they were wondering where can they get personal protective equipment, how are they being protected? And so this is something that we have been raising with our healthcare partners, and I know it's on their minds as well. We see this first step with restricting the number of locations that someone can work when it's in a long-term care home or retirement home, and I think that that by extension, the more we can restrict the number of exposures people have, the better in home care settings as well. And so this is certainly something that is being examined.
Thank you.
Thank you, everybody. This is all the time that we have today. C'est tout le temps que nous disposons aujourd'hui. Merci beaucoup and have a great day. Bonne journée.